For my constructive speech, 5 minutes on the clock, starting now. Hello, I'm Jayel AFF, and I affirm the resolution. The U.S. should adopt a universal healthcare system. In this constructive speech, I'll be explaining my weighing mechanism, analyzing the resolution, and then stating my reasons why the U.S. should adopt a universal healthcare system. My weighing mechanism, or set of standards you can use to judge this debate, is cost-benefit analysis. This judging criteria suggests how the judge should award the win to the team that provides a better ratio of benefits to costs. Lastly, please allow me to define some of the words in the resolution. I would define the U.S. as the federal government of the United States, should as an obligation, adopt as to implement, and universal healthcare system as a slightly modified version of the NHS or United Kingdom National Health Service. The NHS is a taxpayer-funded system and one of the most successful in the world. Patients receive free general practitioner consultations, the accident and emergency department access, maternity services, and if referred to by their general practitioner, treatment by a specialist. However, citizens will have to pay for prescription drugs at a fixed price of $12 regardless of medication or quantity, dental care, and eye care. This system would be modified to suit the U.S. by having modest tax increases of 2 to 5%, and to make up for that, the government would streamline away from admin inefficiencies such as overstaffing. Compared to Canada, the U.S. has 44% more administrative staff. Inflated to the current dollars in today's population, the estimate of per capita administrative excess in the U.S. when compared to Canada translates to a gap of $340 billion. By avoiding things such as this, we can prevent the population from paying unnecessary taxes. With that being said, I'll not be stating my contentions or reasons why the U.S. should adopt a universal healthcare system. Contention 1, universal coverage. Subpoint A, lack of insurance opportunities. Adopting a universal healthcare system can benefit Americans across the country because insurance and access to healthcare is becoming a luxury. According to the American Medical Student Association, 80% of the uninsured are hardworking citizens but can't get their insurance through their work for 3 main reasons. 1, their employer doesn't offer it. 2, the employer's premium share is too high. Or 3, they're not eligible for health insurance. For example, they're newly employed or work part-time. Furthermore, many doctors that specialize in the mental health field, such as psychiatrists, don't accept Medicaid or Medicare. By adopting a healthcare system similar to the NHS, every citizen will have access to sufficient healthcare, regardless of what their job offers and what certain doctors accept. Subpoint B, accessibility. With a universal health system, people don't need health insurance and have access to healthcare without too much work. People have the right to healthcare, physical and mental, regardless of their financial status. By adopting a system similar to the NHS, the federal government can fulfill their duty and protect U.S. citizens. Contention 2, economic benefits. Subpoint A, decreased costs. In the UK, according to the IRS or Internal Revenue Service, only 5% of the citizens' income is spent on their healthcare through taxes. On the other hand, according to the Peter G. Peterson Foundation, the U.S. has spent a total of $4.1 trillion on healthcare, averaging $12,500 a person. By adopting a taxpayer-funded system, these costs will be decreased for people across the country. Subpoint B, citizen health. By adopting a universal healthcare system, the government and people can be more productive. The U.S. has very high obesity rates, infant mortality rates, and low life expectancy. People are in bad health unnecessarily, and a portion of this problem is due to people not having health insurance. If we could prevent this, we'd be potentially saving lives, leading to an improved demographic structure of society and economic growth. Contention 3, positive effects. Subpoint A, community orientation. With our current free market system, the cost is a major factor that determines the healthcare provided. This means that some companies are unable to provide the most effective medicine at a reasonable price because it'll affect their profit. A way to compare universal healthcare to a free market system is to compare nonprofit hospitals to for-profit hospitals. While for-profit hospitals have to put their shareholders and investors first, a nonprofit institution can put its customers first and put more effort into achieving the best possible outcome for the patient. A patient-centered approach typically results in higher patient satisfaction rates with healthcare services, and a universal healthcare system can provide that. Subpoint B, eliminating waste. Hospitals have a large waste footprint, producing 5 million tons of waste each year. I'm not suggesting we get rid of hospitals. However, having universal healthcare can prevent a lot of waste. For example, in the NHS, medical records are shared. This can prevent duplicate paperwork. Other benefits are reducing the waste of claim approval and insurance submissions. To summarize, my first contention is universal coverage. Subpoint A, lack of insurance opportunities. Subpoint B, accessibility. My second contention is economic benefits. Subpoint A, decreased costs. Subpoint B, citizen health. My third contention is positive effects. Subpoint A, community orientation, and subpoint B, eliminating waste. Thank you. I yield my time to the judges now.
All right, I have 2 minutes on the clock for our first cross-examination. This is the negative cross-examining the affirmative.
Okay then. Are the judges ready? Okay, are the opponents ready? Well, opponent.
Yes.
Okay, all right, thank you. I'll start my time right now. So, hello there. I would like to ask a few things about your plan. Is that all right?
Okay.
So, first of all, doctors, may I know, compared to the current wage of $299,000 on average for a doctor, would the wage for a doctor go up, stay the same, or go down?
Well, it depends. So firstly, in here, like it depends on what the doctor chooses. They can choose to engage in private practice, which is separate from the universal healthcare system, or like.
Okay, so basically what I'm asking you is, if your plan is implemented, will doctors' wages go up, stay the same, or go down on average?
If they were part of the universal healthcare system, it would likely stay the same.
Okay. My next question about your plan. So does your plan include access to abortions?
Yes, it can include. Yeah.
Okay. My next question to you is this. So I believe somewhere in your constructive, you talked about how healthcare is extremely accessible, and you use how Britain has like the best healthcare system. Is that correct?
Well, it depends on what you're saying. If you're saying I said the current healthcare system is accessible, I did not say that. I'm
No,
saying
no, no. You're saying that the British system of healthcare is accessible. Is that correct?
the yes, NHS.
Okay, then. Well, according to the Wall Street Journal, I'm pretty sure they said that across hospitals in London, they saw patients crowding the hallways, having to wait 12 hours for treatment. Would you consider that accessible?
Well, firstly, the hospitals don't include the universal health system because there are certain hospitals that are separate from the NHS. Of course, private.
No, those were hospitals operated by the NHS, I'm pretty sure, or the universal healthcare system by Britain. So
does the evidence specify that?
If you go to Wall Street Journal, I'm pretty sure you can read an article about how they saw packs of consumers, I believe, in the hallways and having to wait 12 hours for treatment. But I am unable to provide that to you because you need to look at it yourself. Sorry.
All right, so we're about to go into our first prep time now. I have 1 minute on the clock to prepare for the next segment. 1 minute beginning now. All right, your prep time is up. I have 7 minutes on the clock for the first negative speech, beginning when you're ready.
Okay, then. 1 moment. Okay, there we go. Judges ready. I believe the judges are ready. Opponents ready? Okay, then. Starting my time, 7 minutes, starting my time right now. Government should do only things that a man cannot do better for himself. Abraham Lincoln. Universal health care is something that would take power away from people who know what they're doing. We're taking away the decision-making ability of the doctor and medical professionals and putting them in the hands of bureaucrats. People who do not care about your individual needs, but rather which ones are the most cost efficient. This policy will likely also legalize many dangerous medical procedures, setting a dangerous precedent. We should not let bureaucrats have the power to control healthcare. We should let those who have worked and have experience in the field do it. Good morning, everyone. My name is Alan, and today I'll be representing the concept of the resolution. The United States should adopt a universal healthcare system. This debate should be judged based on true world analysis, meaning whichever team can provide a better world than the alternative shall win. Let's begin. Our first contention is doctors. Subpoint A, the power to decide. With universal healthcare, we're putting the power to decide what treatment someone can or cannot get into the hands of bureaucrats, politicians, an overwhelming majority of whom have no experience in the medical department are taking the reins in deciding what someone can or cannot get as treatments. We are taking power away from medical professionals who have experience and advanced education on the topic. We're putting matters of life and death into the hands of bureaucrats, politicians, and those who have no knowledge about what someone needs. The possibility of controlled rationing of medical supplies and heavy control of technology is detrimental, and we do not want to play this dangerous game. Instead of the medical industry deciding what treatment someone should get, the government decided what people get. Subpoint B, incentives. Currently, doctors are one of the most highly paid jobs in the United States. According to Becker's hospitalreview.com, the average annual income of a doctor is $299,000. Since the government is trying to save costs, it is almost guaranteed that doctors will not be paid as much as before. But according to my opponent's plan, they're fighting for this roughly equal annual income. This has drastic economic effects because if we pay our doctors as much as we did currently, then that would have major economic ripples. Our second contention is quality. Currently in the medical department, the different companies are competing for your purchase of which insurance plan you will choose. When the consumer chooses, they want a plan that is reliable, low cost, and high quality. The basic economic rules show that if you're better than your rivals, the consumers will flock to you. When you get sick, you don't want just healthcare, you want quality healthcare. When it comes to skilled doctors, cutting edge medical technology, and short wait times, no other countries come close to the United States. After decades of competition, we've built a robust workforce of skilled doctors who give quality care for the patients. And the universal healthcare program supply will be diminished and people will lose incentive to become a doctor. Our third contention is innovation. The United States spends more than anyone else in the world when it comes to biomedical research. Rarely does countries where the government controls healthcare come out with new groundbreaking medical discoveries, as the incentive just isn't there. Here in the United States, finding new medical cures or technology is profitable, which explains why the lion's share of medical research investments comes from the private sector. Universal government-controlled healthcare would basically mean that finding new cures would either have little reward, if any. Profits drive the innovation. You take away the profits, you surely take away the innovation. Our fourth contention is abortions. And abortion is a process where a child is exterminated while in pregnancy. Why I'm mentioning abortions in the universal healthcare debate? According to liveaction.org, abortion is considered a health procedure. In a status quo, abortions are around $900, so the universal healthcare would expand access to abortions. This is wrong. Abortion is no different from killing your child. Expanding access to abortion means that children, who are the bedrock of our future, are being killed. It will not save lives, it will simply make it worse. Killing innocent children who have not seen the light of day is wrong, and the financial situation should never be a reason to kill someone. Our fifth contention is confiscation. In the current world, a large group of people voluntarily come together to entrust a sum of money in the hands of a third party in exchange for covering medical costs. This is called insurance. In my opponent's world, the government has to confiscate your money, my money, and the judge's money to fund other people's healthcare. In a sense, the government will confiscate your money to pay for other people's healthcare. A confiscatory model is something that is dangerous, and it may set the precedent that could lead to socialism. In conclusion, my world will be much more favorable than my opponent's. In the world my opponent wishes to create, bureaucrats will take power away from doctors and patients. In the world I fight for, doctors and patients work together to find a plan to cure sickness or injury. In my opponent's world, they fight for the government deciding what you can or cannot get as treatment. The government has not assessed or checked you up. Instead, they're just thinking, what is the most cost efficient? Letting the government ration out treatments is dangerous, and we cannot let such things happen to our healthcare system, or our people will go without care. Furthermore, the government is put in a limbo where they must choose between decreasing doctors' wages or bearing the enormous costs. If the former is enacted, then it disincentivizes people to become doctors. If the latter is enacted, then the government will have to bear the cost of paying an unworldly sum for doctors, which will have major economic ripples. Currently, competition fuels quality. You take away the competition, you take away the quality. Innovating in the health industry is extremely profitable. Finding new cures, treatments, or technology is highly profitable, and universal healthcare would make the reward little, if any. Discouraging medical experts from finding new treatments is the last thing we need. Universal healthcare will also likely legalize abortions, and the killing of children of the future is unacceptable. Due to abortion alone, we may not be saving lives, but rather costing lives. Also, in my opponent's world, a confiscatory method of economics will be put into place. This is unfair to those who have to surrender their wealth to pay for others' care. Now, I would like to continue on with the rebuttal of my opponent's case. Now, my opponent's case talks about how insurance opportunities will increase in accessibility. Now, my opponent's subpoint A about insurance opportunity, once again, if this is implemented, then yeah, sure, some people will get more care. However, the majority of people will have to suffer the consequences of lower quality care and less high quality care. Also, my opponent says that her plan is very accessible to everyone. However, in Britain, as seen before, healthcare actually takes it's actually The Guardian who posted the article, and I apologize for giving the wrong source. But basically, they went to London, and several hospitals were packed with people in hallways, and they were waiting as little as 12 hours, as much as 12 hours for healthcare services. And that number is not actually just a little bit, but 6.2 million people annually. That is way too many people, and with adjusted for population, that is simply way too much. My opponent's second contention about economic benefits and how government saves costs is not really true either, because she does not plan to repeal any of the government, she does not plan to repeal enough of the government programs that are costing the government too much. So it won't actually be enough to fund universal healthcare. Furthermore, she said something about citizen health and how people will be more productive with less diabetes and obesity. However, in America, we have a lot of that. And in fact, my opponent doesn't really lay out a plan to how he planned to solve this problem. And finally, my opponent says that there's a lot of positive effects and satisfaction with customers. However, low quality healthcare and 12 hours of wait time is not really satisfactory. Overall, a vote for the con is a vote for a better world. Thank you for your time.
Cool. We're now going to go into our second cross-examination. This is the affirmative cross-examining the negative. We have 2 minutes beginning when you're ready.
All right. Are the judges ready? Is my opponent ready?
Absolutely.
All right. 2 minutes on the clock for cross-examination.
I'm fine. I'm sorry.
Beginning now. So, do you agree that maintaining good mental health is important?
Absolutely.
Okay. How do you respond to the fact that many mental health doctors, such as psychiatrists, don't accept Medicaid and/or Medicare?
So basically, you're asking me that it's can you repeat the question? I'm sorry.
Many mental health doctors, such as psychiatrists, don't accept Medicaid and/or Medicare. So, what is your response to this?
So basically, off of your question, I'm assuming the fact that your plan includes access to mental health. Is that correct?
Yes.
Okay, then. Well, then instead of so psychiatrists currently, they cost some money. Is that correct?
Yes.
And that is a system that we must maintain due to the fact that ensures high quality. If a lot of people came into a room, certainly with, as you say, mental health problems, is that correct? That will cause a lot of clogging, and the quality of healthcare will go down in general. So no, it will not benefit the people if we implemented universal. It will not benefit mental health people if we did implement universal healthcare.
Are you aware that hospitals produce 5 million tons of waste each year?
Yes. Do you plan to change that?
Yes. And I'll get more to that in my next speech.
Okay, can I just clarify a little bit? So basically, you're saying that we should be handing out more services, meaning we're overworking the hospitals, and then that somehow generates less carbon.
No, I'm saying that, as I mentioned in my constructive, there are ways we can reduce waste.
Okay, yeah, but
So to get
never mind. Continue. I'm sorry.
get into your first contention, you said how doctors are the highest paid jobs in the U.S.
I have the highest.
You said,
Sorry.
and you said that keeping doctors paid the same would cost government more.
It would.
Right?
Well, we can't really compare it to anything because there's no precedent. But I'm saying that it will cost the government a lot.
And there is a precedent, being the national health system. Thank you. My time's up.
All right, we're now going to go into our next prep time. We have 1 minute on the clock, beginning now. All right, the prep period has concluded. We are now going to go into our next speech. It is a 4-minute speech by the affirmative, beginning when you're ready.
All right, are all the judges ready? Wait. Is my opponent ready?
Mhm.
Okay. 4 minutes on the clock for a rebuttal, beginning now. Hello, I'll now be starting the third segment of this debate, the rebuttal speech. As a reminder, my framework is cost-benefit analysis. This means that the winner of this debate should be the team that provides a greater balance of benefits versus costs or harms. My opponent argues we should use a two worlds analysis, but I would argue that two worlds is just a subcategory of cost-benefit analysis, because you could argue that a better world is one that has more costs than benefits. So I believe that my cost-benefit analysis framework could cover his framework too, but I still believe it's the best framework for this debate, considering we are debating a policy resolution. In this speech, I'll recap my contentions, provide rejoinders, and then rebut my opponent's contentions. So to recap my contentions, my first contention is universal coverage. Subpoint A, lack of insurance opportunities. Subpoint B, accessibility. My second contention is economic benefits. Subpoint A, decreased costs. Subpoint B, citizen health. My third contention is positive effects. Subpoint A, community orientation, and subpoint B, eliminating waste. So to get into my opponent's my opponent's constructive speech, my opponent's first contention is about doctors, and his subpoint A for that contention is the power to decide. So my opponent argues that politicians are taking away choices from doctors, and that shouldn't be happening because politicians don't know anything about about the medical field. However, there's nothing. I have not said in this speech one time that politicians would be the people making the choices. You see, of course, there will still be doctors hiring. Politicians are not going to be making medicines or anything. They're just implementing a system, which is what they specialize at because it's a new policy. So I would disagree with this. My opponent's point B is incentives, and my opponent explains how doctors are the highest paid jobs in the U.S., but he says that keeping doctors' pay the same would have a major economic effect. But firstly, we're keeping the pay the same, and also even if the pay was higher, still the taxes would be higher, but it wouldn't cause an economic crash. You see, as I mentioned in my introduction when I was explaining my plan, I said that taxes would be around 2 to 5% of a citizen's income. This is not a major economic crash worthy statistic. His second contention is about competition, and he explains how there's going to be less quality. And he says that no countries come close to the US when it comes to healthcare because we have such great competition, but this is actually not true. America has high obesity rates, a lot of chronic diseases, low life expectancy. So I don't understand how my opponent can argue that we are so innovative and everything when the stats show that Americans have pretty poor health. His third contention is about innovation. His subpoint A is that there would be groundbreaking medical discoveries and they would be profitable, and that finding cures would have low reward if any. However, firstly, there would not be the doctors would not be, my opponent is correct, there wouldn't be a lot of competition. However, this is beneficial because it can prevent firstly false information spread, because it's the government in control of all this. I would argue that, and also once again he brings up the groundbreaking medical discovery thing, which I said to his second contention would not be true. My opponent's fourth contention is about abortions, and he argues that the universal health would support this, and this is wrong. Now, I don't want this debate to turn into an abortion debate, so I'm aware that if I say too much about this, it would spiral into this. But I would say that it's a really bold claim to say abortion is wrong, especially in a debate where abortion is not really relevant. So, yeah, and with that, that concludes our rebuttal speech, so I yield my time to the judge now.
All right, we're going to go now into another prep time. Got 1 minute on the clock beginning now. All right, prep time is up. We're now going to go into the final negative speech. I have 5 minutes on the clock, beginning when you're ready.
Okay then, judges ready. Opponent ready.
Yes.
Okay then, 5 minutes on the clock. 5 minutes on the clock for the negative speech, starting my time now. Good morning, everyone. My name is Alan, and today I represent the consider resolution the United States should adopt the universal healthcare system. I'd like to start off by going through some rejoinders about what my opponent said to me in her rebuttal. So to start off, my opponent's response to my first contention, subpoint A, is that politicians are not the one making the choices. Well, that's not true, because according to PragerU, when in Britain, the politicians decided that you can't have back surgery, a bypass, or cancer treatment under certain conditions. So yes, the politicians do get to decide what you get or don't get. Also, my opponent says that in her response to my subpoint B, she says that keeping the pay the same keeps the cost the same. Now, my opponent, I think, missed one big factor here. The big factor here is that currently doctors are being paid by companies, not the government. So it doesn't really make sense how adding an entire new cost to the government would not change anything. And also my opponent's response to my second contention says that we have poor health and we have poor quality healthcare. However, this is not true either, because in things like highest rate of survival cancer and the best treatment of chronic disease, as well as the most preemptive cancer screening, according to Business Insider, we have amazing health and we have amazing quality healthcare. And my opponent is not really, she's kind of cherry picking her evidence. And I have around 25 diseases where America ranks #1. And if you would like me to read them to you, I most certainly will. My opponent's response to my third contention is that there's no competition, which is a benefit because there's no false information. Once again, in Britain, they made the innovation of new cures not so profitable anymore. So that means that less cures and less research is going into this. And currently in the United States, it is profitable. And that's why private companies are investing a lot of money into it. And that is why we have so many groundbreaking discoveries. My opponent's response to my fourth contention is basically saying it's a bold claim to say that abortion is wrong. I have proven that killing people is wrong, and abortion is basically killing the bedrock of our future. They're killing the pillars of our future economy, and that's wrong. And she also says it's not relevant, although it absolutely is, because her plan includes abortion, and abortion is a healthcare service, and it is a really big deal, actually, and it is relevant because it's part of her healthcare plan. My opponent's response to my fifth contention is none, because she dropped it. So my fifth contention is talking about confiscation. Now, this is actually really important due to the fact that it's not really fair for me to have to pay for your healthcare, or the judges have to pay for each other's healthcare, because you made your money, so you should keep your money, and you should not have to pay for other people's things. Surrendering your wealth to pay for other people's goods is not good, and it's not capitalist, and it's socialist. Now, I would like to continue on with two-worlds analysis thinking about this. My opponent and I agree that cost-benefit analysis and two-worlds analysis are kind of the same thing. So I'm just going to go off two-worlds analysis because I feel like it's a better way to judge it. Now, in the world that I'm creating, which is the negative, where we don't have universal healthcare, doctors retain the power to decide. In my opponent's world, they established the British system where the politicians get to decide what treatment you can or cannot get, and may even restrict you from having certain treatments, which is very dangerous and could kill some people or let them die. And also in my world, doctors will keep their incentives to be one of the highly most paid jobs in the United States. Now, my opponent decides they also want to do this, but that will bear the enormous cost of the economy, because currently doctors are paid by private companies. And if the government has to pay the same amount as the companies did in the status quo, then that will be a huge sum of money that I believe the United States is not able to pay, or is too much. My opponent does not really respond to my contention on quality correctly. And in fact, in my world, the quality remains good. Also in my world, innovation is encouraged because profits and new groundbreaking medical discoveries are also found. And also in my world, we would keep a controversial and unethical practice illegal, or mostly illegal. And also in my world, we would not confiscate each other's money to pay for others. I would like to finish off my speech with some voters. Now, my first voter will be that my opponent has been cherry picking her evidence when it comes to saying that America is bad at certain treatments. Voter B, I believe I've won on two worlds analysis / cost benefit analysis. I believe I presented a better world. And C, I believe I have responded to all of my opponent's points, and she dropped my fifth contention. A vote for the con is a vote for a better world. Thank you very much for your time.
All right, we're going to go now into a 1 minute period of prep time, beginning now. All right, I have 3 minutes on the clock for the affirmative to give their final speech, beginning when you're ready.
All right, are the judges ready? Okay. Is my opponent ready?
Yes.
All right, 3 minutes on the clock for summary speech beginning now. Hello, as a reminder, my weighing mechanism is cost-benefit analysis. This judging criteria suggests that the winner of this debate should be the team that can provide more benefits than costs. In this speech, I'll recap my contentions, provide rejoinders for my opponent's rebuttal, and cite the reasons why the affirmative should win this debate. To recap my constructive speech, my first contention is universal coverage. So, to tie into rejoinders, my opponent responds to this someone by saying, if this is implemented, sure, but the majority will suffer lower quality care. But he's using points that I have already rebutted in this rebuttal, because I have explained why care will not become lower quality and how competition can negatively impact the medical field. My subpoint B is accessibility, and my opponent argues that in Britain, the Guardian newsletter, according to that, found that several hospitals were packed knowing 12-hour waiting time. But the evidence does not specify if those hospitals were operated by the NHS. So this contention, the information here can be completely not relevant to the plan we are debating with. My second contention is economic benefits. Subpoint A is decreased cost, and subpoint B is citizen health. My opponent argues that my subpoint A is not true, and because the decreased cost won't be enough to fund the universal healthcare system. However, I'm giving examples from the UK, and there it is enough to fund it, so it's unreasonable to assume that it wouldn't be enough here. My opponent responds to my subpoint B by saying that there's no plan to solve this. However, the plan that I have in place is to adopt the universal healthcare system being the NHS. So I do have a plan to solve this, and my opponent responds to my third contention by subpoint A and B and groups them together by saying my subpoint A and subpoint B for that contention is community orientation and subpoint B eliminating waste, and he argues that low quality and long wait times isn't satisfactory, but he completely drops these subpoints in the process. He did not address the community orientation or eliminating waste, just adds one of his points on there and assumes that it'll be enough to rebut the entire contention. So with that being said, I'll now say the reasons the affirmative should win this debate. My first reason is that I provided a line-by-line rebuttal for the negative constructive. My second reason is that the affirmative was won on topicality. I've explained that cost-benefit analysis is a better framework due to us debating a policy resolution, or a resolution that suggests a course of action. We need to weigh the benefits to costs to decide if we should adopt this resolution. Another reason is that my opponent has low-quality evidence. He uses sources such as the Guardian newsletter and Business Insider, while the affirmative is using the Internal Revenue Service and other very worthy and known associations. Finally, my last reason is that the affirmative best met our chosen judging criteria. At the beginning of this debate and throughout all the other speeches, I mentioned that my framework or weighing mechanism is cost-benefit analysis. In this debate, I've tried to demonstrate that the benefits of adopting a universal healthcare system outweighs the cost. For example, eliminating waste outweighs the cost of only modest tax increases. For these reasons, you may confidently cast your ballot for the affirmative. Thank you.
All right. Thank you so much. That is the conclusion of our final round of the Ready, Set, Debate Slam tournament. Great job to our debaters, and thank you again to our judges for being here and doing a great job.